Namibia has appointed a team to facilitate the importing of a COVID-19 vaccine. The country says it wants 20% of its population to be vaccinated. Namibia, meanwhile, has recorded more than 16,000 COVID-19 cases with more than 160 deaths. We are now joined by the Health Minister of Namibia, Kalumbi Shangula. Minister, good morning, and thank you very much for your time this morning here on Today on eNCA. First up, when I started the program now at 9 o'clock, I made a comment that the whole world has been waiting for a vaccine for months now. The vaccines are arriving, and we see the wealthy nations fighting that every citizen in their countries should get the vaccine. And I said that they are in a privileged position, but many other countries, dozens of countries, won't even be able to afford a vaccine, and they might afford to buy a vaccine to give it to 1 in 10 of their people. What is the situation for you in Namibia?
Thank you very much, and good morning to you, and good morning to the listeners. I would like to express my appreciation for inviting me to this interview. I'm happy to share the experience of Namibia and the plans of Namibia with regards to the possible access to vaccine for our Namibian population. At the beginning, let me state that Namibia, like many other countries, have been affected by COVID-19. As you rightly pointed out, so far we have recorded 16,726 confirmed cases. Although the biggest number of them have recovered, we still have about 1,723 active cases, and we have recorded 163 deaths. Now, faced with that situation, we have instituted measures to contain the spread of the infection, starting with the state of emergency from the 17th of March until the 17th of September, and thereafter we continue introducing preventive measures under the Namibia Public and Environmental Health Act. The discovery of the vaccine in many parts of the world offers another avenue for prevention of the infection. To that effect, we have established a COVID-19 vaccine national task force. Now, the function of this task force is really to ensure that when the vaccine becomes available, Namibia does also benefit from the vaccine. We have been engaged with various stakeholders like the World Health Organization, the African Union, the Africa CDC, SADC, and COVAX facility, which is a coalition with WHO, CPA, and Gavi. So in August, actually, this is the time when we have established our vaccine, COVID-19 vaccine national task force. And it is a multidisciplinary, multi-sectoral body consisted of the diagnostic laboratories, the laboratory authorities, the institution of higher learning, and also experts from the Ministry of Health and Social Services. And their main tasks are really to review the available scientific evidence on the candidate vaccine and also to guide the ministry on the best choice for the vaccine.
When do you expect them to complete their role to enable you, as you get into 2021, to know which will be the appropriate vaccine for Namibia and how much you're going to need to get access to it? Because we hear it's very expensive, especially to transport COVID-19 vaccine?
Well, we have joined the COVAX facilities, and we think that if we join the COVAX facility, we stand a better chance to, first of all, to access and also to be able to afford. We are targeting especially the frontline health workers and vulnerable people. Now, when we can access the vaccine, it really does not depend on us. It depends on the development of the vaccines. It depends on the approvals of the vaccines, and also when those will be made available to the COVAX facilities so that they can then be distributed to the states which have signed up. Now, in terms of logistics, we will abide by the requirement which the manufacturer will indicate that this is the storage environment. It should be stored in this environment, and then it will be transported in this particular conditions. Then we will comply with those requirements as stipulated by the manufacturer.
What would your message be to the wealthy nations whom I referred to when I started the program at 9? They are more privileged than many other countries, and they can get as many vaccines as they want for their citizens. They've got the funds. Would you expect some help and support from them as Namibia?
Well, we subscribe to the principle that those type of commodities, they must be shared equally among the nations, because you will never be safe if other people are not safe. And therefore, this calls for solidarity and to ensure that every country will have to benefit from the product of science and technology.
How confident are you about the efforts of SADC and the African Union? Our president here, Cyril Ramaphosa, also keeps on referring to a continental cooperation, a regional cooperation. As Namibia, are you satisfied with the efforts that are being made regionally and continentally?
Yes, I am, and we are strong when we are together, and we become weak if we go it alone.
Okay, thank you very much. Minister, that's Kalumbi Shangula, Minister of Health from Namibia, just sharing with us his views and some information about how Namibia is planning to import a COVID-19 vaccine. They've already established their task team. Thank you for his time. Now.